Hi, welcome to episode 5 of COVID Vaccine Facts and Fiction. How are you doing, Joel?
Hi, everyone. Evening. How's it going?
It's going well. Good to talk to you again. And
Me too. Nice view behind you over there. I like the view.
yeah, thanks. Luckily, I was able to run earlier this week and I took this picture. So there's a lot of talk about Pfizer, about the vaccines. People are still talking about Pfizer's vaccine and about immunization here in Israel, and I think that's going to be the focus of our talk today. One thing we could start out with is the Pfizer agreement. So during my day job, I'm a patent attorney, and I look at a lot of agreements. And luckily, this agreement between the Ministry of Health of Israel and Pfizer was published. So we're able to see exactly what the parties agreed to. And there was concern that, hey, look, there's this agreement and Israeli citizens are becoming guinea pigs. They're being tested on, and that data is being transferred to Pfizer. So when you look at the agreement, and I'm going to share the screen actually so we could all look at the agreement. Here's the agreement between Pfizer and the Israeli Ministry of Health. That's the MOH. Well, what's this all about? Why was this agreement put in place? And the understanding is, and it says this in the agreement, that there is supply to Israel. And I think there's an advantage to what's happening in Israel that we touched on previously, which is the fact that all of our medical records through the 4 HMOs, the public HMOs, are private. They're kept. They're available and they're digital. So it's very easy to understand, maintain, and mine that data. So that's an advantage that Israel has. And Pfizer saw that and said, let's try to use that data to learn more about the vaccine. Because as we know, it hasn't been used for years. It hasn't been tested for years. It's less than a year old. And people were concerned that this sort of use of the data was going to impact their privacy. So here is a listing of what is going to be transferred from the Ministry of Health to Pfizer. And it says specifically that it's going to be data that is de-identified. There's no personal information here. And there's also no money exchange between the Ministry of Health and Pfizer, aside from obviously buying the vaccines, which Israel did according to the agreement. But for the data itself, it's sort of a win-win situation because Pfizer is going to be getting this data. They're not going to be able to identify who has what the medical history is of the specific individuals. No one's ID numbers or name is going to be disclosed, but they're going to get some general information about how many COVID-19 cases there are, how many hospitalizations, how vaccines impact various populations. What's the Ministry of Health getting out of this? And I think that we see from this agreement that they're getting expertise that Pfizer has, which is important for population of Israel to be able to use the vaccines better, to be able to maintain and control the use of vaccines to the proper populations, and basically get the most out of the vaccines based on their vaccination history up to date. That's my understanding of Exhibit A of this agreement, which is publicly available. So maybe I'll put a link in the video where everyone can look at the agreement themselves get an impression about this agreement. But I don't feel, as someone who, since last video, got my first vaccination, I don't feel like I'm being a guinea pig or tested on. And I have no problem that this agreement exists between Ministry of Health and Pfizer.
So that was very good. It's very important that we clarify. Nobody's being tested on in Israel. These, both Pfizer and Moderna received emergency use approval by the FDA. The Israeli Ministry of Health has approved that. These are approved vaccines that are now being widely distributed and used in Israel. What's being shared exactly is what was shown in Exhibit A is data. There's no experiment. This is not an experiment. This is not a clinical trial. This is a mass vaccination program in times of pandemic.
Right, that's important to stress. So one other topic that we saw in the news this week was something about military intelligence. That yeah, some people have a hard time understanding that term together, military intelligence. In terms of the report that was issued, they expressed concern about a new Israeli mutation, and they said the fact that there is a population that is vaccinated and part of the population that is not vaccinated. So it could be that there's going to be some sort of mutation that's developed that is resistant to the vaccine. So can you expand a little bit on that and what your thoughts are on that report?
So there was an announcement, press release, or whatever it may be from that organization yesterday, where they claimed it is theoretically possible and we should be concerned that the Israeli mutation, they called it, would pop out as a result of the mass vaccination program. So we need to break this down into two parts. Vaccines are not antibiotics. These are not bacteria. These are not mechanisms of escape and resistance like bacteria have, and they become resistant to the antibiotic. Think about vaccines for all the other diseases that we know: measles, mumps, rubella, varicella, flu, everything that we know that has a vaccination program. You don't have, as a result of immunization and vaccination, which reaches herd immunity in those cases, a variant that is no longer able to be neutralized by the antibodies. This claim doesn't seem to have any biological relevance. And I think that maybe they use the example of antibiotic resistance as their case. But several organizations have already come out today with debunking messages saying that there's nothing of concern, that there is no known mechanism of an escape mechanism as a result of immunization. I think we can pretty much put that aside. We certainly don't need to be talking about the Israeli mutation.
Okay, so there's been a lot of talk about other mutations, about a South African mutation, UK mutation, Brazilian mutation. So even if there is no Israeli mutation, these are potential other mutations that can enter Israel. And one of the things we saw this week is talk about closing down the airports and stopping all flight from outside of Israel into Israel. And I guess there's one main international airport that's closed down. That's where all the traffic comes in from internationally. Otherwise, Israel is more or less an island, at least politically. How is that going to impact the mutations and the spread of the foreign mutations here in Israel?
All right, so let's talk about the mutation. Let's remember, when we're talking about this virus, SARS-CoV-2, the virus uses the spike protein to bind to our cells and get inside the cells and become infectious. That same spike protein is what the vaccine is developed against. Now, the mutations that have been found are changes inside the spike protein that have made these variants more infectious and seem to be causing more severe disease in even younger populations. Now, because we're able, and we discussed this in previous episodes, to sequence the genomes of these variants very, very quickly, we already know where those mutations are. We know how to identify them. So you can make a synthetic virus that contains those mutations, those variants, and you can test if the antibodies that are made as a result of vaccination are still able to neutralize. What does that mean? What is neutralization? The spike protein binds to a receptor on the cells, the human cells. These antibodies basically block the spike protein and they cannot bind to the cells and get in. That's what neutralization means. And it's these neutralizing antibodies that are important ones. So Moderna just announced 2 hours ago data showing that when they take antibodies out of patients that receive the vaccine and they test them against these synthetic variants, those antibodies are still able to neutralize the variants from South Africa and from the UK. Nobody's tested, as far as I know, against the Brazilian. Last week, or about 10 days ago, the Pfizer also made an announcement with very similar findings, that if you take antibodies from patients that receive the Pfizer vaccine and you test them in a dish, they are able to neutralize the two variants. So as far as we know, and this is preliminary data, but it needs to be tested, as far as we know, the vaccine makes antibodies that protect against these variants as well. Now, why would you want to shut the airport? These variants that have been detected in Israel from South Africa, and the South African mutation and the UK mutation, have been detected only in people that have come from outside of Israel. As I said, it seems that these are more virulent and causing more severe disease. If you shut down the airport, you can shut down the traffic of the number of those mutations that would come in. You get more time and many more people vaccinated, and we can start to look at very large numbers of people with antibodies to see if those antibodies are neutralizing and still protective against these variants. So I think it's probably similar in concept to the original. If you remember in the first lockdown, the second lockdown, the third lockdown, we're always talking about flattening the curve. I guess this is flattening the curve in terms of not allowing these variants to become dominant and take over the number of infections that are happening in the country. That's the way that I see it, at least.
So in your opinion, is there mutation happening that maybe we're not even recognizing of the virus here in Israel? Like, I have a friend who was talking about his experience working in one of the leading hospitals in the corona ward at the first wave versus now. And what he's seeing is that a lot of people are dying even after ventilation, even being hooked up to the ECMO machine. People are just not getting off of it. It seems to be that this third wave that he's working in the hospital seems to be worse.
Yeah, so I don't know if there's a particular new variant. There will be variants. Viruses mutate. There's going to be mutations. The beauty with these messenger RNA vaccines is that they can make new ones very quickly. Because like I said, once you sequence and you know what the variant is, you can just make a new vaccine. However, that does not mean it's going to be like the flu vaccine and we're going to need new ones every year and new mixtures. Everything that we're learning as it's going is a result of things that are happening in a very short period of time. We need data and we need time. It's exactly the same as the concept of when these vaccines received the emergency approval, we didn't know, and we still don't, although we have hints, if it stops transmission. We will know when we have data. We need time and we need data. We didn't know if these new variants would be neutralized. Now we have the beginning of that data. It took time to do those experiments. We're living in a very weird period of time where data is happening all the time, and we need that data to get understanding. We still don't know if the immunity to the vaccine is stronger and better than immunity to infection. We're only going to know that with time. Everyone has to realize that it takes time, and nobody has all the answers. Nobody. We'll get answers as we do more experiments and we get more data. And by the way, the best data is going to come out of Israel. We already had a publication last week from Clalit with 200,000 people that were vaccinated. 200,000. That's 3 times the amount of both Moderna and Pfizer together in their phase 3 studies. 200,000 people, they were tracking them, they're looking at the number of infections. They already showed a modest decrease of 33% after 14 days following the first immunization in the number of infections. It's all going in the right direction. You just need time to get the data.
Okay, so it looks like we're going to have a confirmation of the efficacy based at least on the preliminary data that's coming out of Israel.
Right.
And hopefully that will allay certain fears that people have about the vaccine. One last issue to discuss is some news that came out of Norway last week. There were reports of elderly people dying after vaccination. And if you could address that, that would be great.
Okay, so Norway decided to vaccinate the people in old age homes first. There were 23 cases of deaths after the vaccination. As of last week, 13 of them were still considered to be still required an investigation as to whether there was any relationship. There was a press release, I believe, that just came out. I'm going to try and find it. The WHO came out with a press release right here saying that despite the deaths, they could not find any connection to the vaccines, and the fact that COVID is so much worse, the recommendation, and even the Norway Ministry of Health continues the recommendation to vaccinate that frail population. So the deaths were in a frail population, you know, I don't think you could ever rule it out 100%, but the investigations have shown that they were probably not related, and that the number of deaths in that frail population from the virus are going to far outweigh any that's related to vaccine, which they don't seem to be related to the vaccine. But it's, again, the risk benefit numbers that we did last week. It's going to be very similar there as well.
Okay, great. Thanks a lot. So anyone who's listening here, please feel free to continue asking questions, and we'll try to address them. We'll try to talk in our subsequent episodes about your questions and try to answer them. Thanks, Joel. Have a good evening.